Good afternoon, everyone. I am Dr. Avas Pani, consultant pediatrician, Apollo Cradle, Kondapur. Today, we are going to speak regarding a general topic of vaccination. It won't be very technical. I want to just impart some information to the parents, especially some myths that are associated with vaccination, so that the few people who are not inclined for vaccination also will start giving vaccines to their children. So, as we all know, immunization or vaccination is a process where the person is made resistant to infectious disease. So, how the vaccines work? They stimulate our body and our own immune system to protect against the vaccinations, protect against the disease. So, once you give a vaccine, particular vaccine, the body thinks that the disease is there. Like suppose say chicken pox, we know that once somebody gets chicken pox, he won't get it for the rest of his life. So if we but still chickenpox is having some risks associated with it, the actual disease. So vaccination is the process when the risk of the disease is taken out and only the benefits of the disease, that is subsequent protection, is given to the person. So in India there are like 11 to 12 life-threatening diseases which the government covers free of cost in the National Immunization Program, like tuberculosis, diphtheria, tetanus, polio, hepatitis, influenza, measles, rubella, Japanese encephalitis, rotavirus. These many diseases are being covered as of now in the Government of India program. So benefits of immunizations are like it is very cost effective strategy to improve the health of the particular individual, and as a result of which the whole population is also benefited. It prevents childhood sickness and disabilities. Like very dramatic example is polio. Now India has declared polio free because in the past so many children were being handicapped because of such a dreaded disease. But now practically we don't see. I have not seen any active polio case in my career at all, and there are no recorded cases also recently in India. So it is a basic need of all children, and it provides personal immunity plus community immunity also. How? Suppose there are out of every 100 people, suppose 80 are having vaccination against particular disease. So the disease cannot come and cause a pandemic. So the other 20 people are also protected if by chance they are not given the vaccines also. So thanks to widespread immunization efforts, the rate of illness or vaccine preventable diseases are very low nowadays, and many diseases are practically like pertussis, suppose, and whooping means mumps. These diseases are rapidly coming down, and as you all know, smallpox has been eradicated in the past. There's a first disease that was eradicated completely due to vaccination program. That was in 1977 or 78. There was the last case of smallpox in the world. So immunization on an average that saves up to 3 to 4 million lives per year. So it's a very big number for such a small, means relatively cheap intervention. We get such a huge benefit. No other intervention has such a benefit of saving so many lives and disabilities also. So there are many diseases where vaccines are available, but the government doesn't give, but we can give from private side. Like pneumococcal disease also started in many government setups also, and then there is the hepatitis A, typhoid, like many diseases where chickenpox, where the government has not yet started, but they are also very important. And private sector definitely has the vaccines to offer to the people who can afford. So there is a standard schedule of immunization that is decided by the Government of India with the consultation with various experts like WHO, World Health Organization, and Indian Academy of Pediatrics, and many other public health experts. They have given their inputs, and government has come up with a vaccine schedule. So that everyone knows, in every child's file you will find a vaccine schedule. So according to the age, the vaccines are supposed to be given. So my point here is that that schedule has to be followed, but by chance if it is not being followed also, it's not a problem. Suppose child has fever or parents are traveling or due to any reason child has missed the vaccine, it can be safely given at a later date when the vaccination is possible. So people tend to fix on the dates that are provided on the left side of the vaccine. So date is missed means they think something is wrong, very big problem is there. It is not like that. At the doctor's discretion, the vaccine dates are actually very flexible. That part we don't tell to public because then public will become lax and they will end up not giving the vaccines at all. So even if some vaccines are missed or any other issues there, please go to the doctor and take his opinion regarding what can be done. If it is missed by a small margin, it can be safely given. If it is missed completely and the next vaccine date has come, then doctor will adjust accordingly and give the advice. I have seen people where the child vaccine is not taken for a 6 months to 1 year period due to various reasons, and they don't turn up and they don't go to the doctor at all, saying ki vaccine is missed, so we didn't give. The date is gone, we have not given. So the chart is only for record keeping what vaccine the child has got, not that to tell the doctor regarding the vaccine. We are getting updated on our own, and any changes to the chart, we religiously do it and advise the parents accordingly. So chart is just for record, not a very big thing that cannot be changed at all. So coming to how vaccines work. So many people nowadays after Corona now, at least many people know how the vaccines, what is vaccine and how it works. But still I would like to say, so example of chickenpox I would like to take again because that's very common disease before, and the disease itself is not very fatal, but around 1 to 2% there can be various complications. So if you are getting the natural chickenpox, 99% nothing happens and you escape out of it and lifelong immunity is there. But vaccines will give the benefit of the natural disease without much chance of the disease complication. Like in chickenpox, there can be meningitis. So many other life-threatening complications can occur. So if we give the vaccines, the chances of those life-threatening complications is negligible, but we get the benefit of lifelong immunity. That is the main aim of vaccines. So the body is exposed to the weakened or dead bacteria or virus pathogen. So the vaccine is made by weakening the natural organism by either killing it and only some parts of the organism is given as the vaccine, or making it weak so that the organism cannot produce the disease, but only the body will see that body has got the infection and produce the antibody so that the future infections are curtailed. So the body is exposed to the organism and then the body makes the immune antibodies. Immune system comes into play and the antibodies are prepared and the body is ready to prevent any further attack of the same organism in the future. So if the body is exposed to the same organism in the future, it is prepared and it prevents the next infection. That is how vaccines work. This is the basic principle of vaccination. So every vaccine is actually disease specific. There is no cross infected. Suppose somebody gets a flu, nowadays some rumor was that if you give flu vaccine, corona is prevented. It is not like that. All vaccines are organism specific and there's no cross benefit out of it. So very specifically, particular vaccine prevents particular illness. So each vaccine adds up to the immunity of the body. So if you give all the vaccines, the child is very immune and it can escape getting the dreaded disease that the vaccines are covering nowadays. So when no one is immunized, the disease spreads very fast across the entire population. That we saw in Corona how it spread rapidly with waves after waves of lakhs of people getting infected per day. So then after the vaccines are done, if the vaccine is given, majority of population is immunized, then the disease cannot travel so fast and the pandemics and epidemics are prevented. So that is how the vaccines protect the individual and also the general population, even if everyone is not vaccinated. That is how important vaccines are. So there are various types of vaccines. Basically, there are live, like I told, the organism is not killed but weakened. So that is called live attenuated vaccine. The organism is not completely killed. Examples are oral polio drops and MMR and chickenpox vaccines. So here the organism is made very weak and given in the form of injection or oral polio drops, and subsequently the person develops immunity and protects against future future disease. So these types of vaccines may require multiple dosings so that the optimal immune response is obtained in the body. And say this is live vaccine. Second is dead vaccine or inactivated or killed vaccine. So the whole organism is killed and made into a vaccine form. So because it is killed, it cannot produce the disease. but the body will recognize the dead organism as an infection and take necessary action, and immunity is developed for future same future disease. These are examples like hepatitis A, rabies, injectable polio vaccine, and typhoid vaccine. These are the inactivated vaccines. And there is some subunit vaccine where the whole organism is not used, but part of the organism is used. So again, it is like the dead part of the organism is used and future disease is prevented. And next is toxoid vaccine, where the vaccine is requiring a part of the vaccine is used and attached to a toxin like diphtheria, pertussis, tetanus. So these are also another type of vaccine. The main thing is the technology. These are different technologies where vaccines are made. Ultimate outcome is same, that vaccine will provide protection from future infection of the same disease. So some vaccines will provide lifelong immunity from single dose. Examples are like typhoid and all. Only one dose is mostly sufficient for whole lifetime of the person. And some vaccines require repeated dosing like tetanus, diphtheria and polio, where if you give repeated doses, the immune reaction is more strong and the whole life means there is no chance of the disease, practically nil chance of disease. Like for example, tetanus, maybe somebody 10-15 years senior to me might have seen hundreds or like that number of cases, but I have hardly seen 2-3 cases of tetanus in my whole career, and zero polio. That is the impact of vaccination. Some people don't believe and take it for granted because they are not seeing the disease around them now. They are thinking vaccines are not important, but it cannot be described how safe the vaccines has made this world for us in this generation. And some vaccines, some organisms like influenza and corona, they change the genetic changes are there. So those vaccines require frequent booster shots. Like influenza requires once a year, and corona practically as of now it is requiring probably every 6 months. Nobody is sure, but already we gave the primary 2 dosages and one booster shot we have allowed after the 6 months. So these organisms are keep on changing. So that's why vaccines are not so effective in these cases, and we require like new strains of the organism need to be incorporated in the newer vaccines and given repeatedly in 1 year or 6 months intervals. So influenza is established every year we have to take those who want the protection, and corona mostly 6 months till the pandemic lasts. So the various components of the vaccines, how the vaccines are made, very minute component is the actual organism. The dead part of organism makes up very less part of the vaccine. Vaccine is like 0.5 ml. What is we are injecting? 0.5 ml we are injecting. Most of it is the preservatives, stabilizers, the chemicals that keep the vaccines effective. And then cell culture materials, sometimes antibiotics are also incorporated so that the vaccine doesn't get bad, rotting, infected. So these are the things, and some mediums are also there to make up the volume up to 0.5 ml. If it is just like 0.0001 ml, you can't inject. No. So to make it injectable, some media are incorporated, and the whole thing is the vaccine. So sometimes the reactions of vaccines are there definitely. They are more to this media than to the actual vaccine component itself, because the organism is very minute, like in molecular level the organism is there. That usually doesn't cause any problems. Mainly it is the adjuvants and other material that might cause some problems sometimes. So how do you know that vaccines are safe? Some people will say, this is something foreign injection we don't want to take. So how to know? So there is a process by which vaccines are made. For that matter, not only vaccines, any medicine, there are phases of clinical trials, mainly phase 1, 2, 3. So in phase 1, there is a less number of people who are volunteers, and they ensure that the vaccine is safe, that if you inject, there is nothing happening to those people. So in around 100 people, they will inject after the research is done, and then they check that none of those people are having any major illnesses after the vaccine and no serious side effects, and the response of the vaccine is also checked. But mainly phase 1 is for making sure that the vaccine is not harming anybody. Second phase is many hundred, like 500 or 1000 people. So here short-term side effects, long-term side effects, how is the immune system reacting, these things are checked. And then phase 3, thousands of people are checked. Again, the same things. What is the rate of reaction? How many people got fever? How many people got serious reactions? All these things are checked. Effectivity of vaccine is checked. So there are various methods by which the scientists they will check the safety and efficacy of the vaccines. So once the vaccine is marketed, we can be very sure that the safety of vaccines is beyond doubt once it is marketed. Once in one case in maybe 5 lakhs or 1 lakh will have some side effect. So we can safely take the vaccines that has been cleared by the Drug Controller of India. Especially but only thing in Corona time, of course, they cut down on the timing. They have made because of emergency use requirement, they have cut down on the timings of the vaccine, the timeline, but safety has not been compromised. We are also seeing so many lakhs of vaccines given, but not much side effects was there. Of course, some will be there, but based on those few isolated incidents, uh, we should not reject the benefits. The vast majority of the people are benefited, so we should not reject those benefits for few stray incidents. So very common question is what are the side effects of vaccination? People are definitely concerned, and before giving vaccines to their small babies and kids, they would like to know the side effects. So side effects are noted down during the trials. Some vaccines like DPT injection have a more chance of local injection site pain and swelling. So again, there are two types of vaccines in DPT. One is the so-called painful vaccine and other is so-called painless vaccine. The technology is slightly different while making these vaccines. In government sector, the wholesale vaccine which causes little more pain, fever and swelling is used. In the private sector, both are available, painless and painful. So the painless vaccine has less chance. In the DPT only, there is a painless and painful difference. No other vaccine has a difference of painless and painful. So all vaccines are painless basically. Very less chance of local site swelling, pain, and fever coming in the first 1 to 2 days of life. So if the pain is there, we can put some ice packs to relieve the pain and give paracetamol to relieve the pain also. So these are the local reactions which occur at the site of infection, that is the swelling, pain and redness and fever also might come. And then sometimes if it is a measles vaccine or a chickenpox vaccine, which is the live vaccine, but live but attenuated we call it, that is the weakened virus. So that can cause a mild disease sometimes, mimicking the actual disease. But this disease is very mild, nothing happens, only local area, little bit red rash might come and child might get some fever. So these are the two major common reactions to vaccines. And the rare reactions are possible definitely. Sometimes it is life-threatening also, but they are very rare. There can be whole body allergy, there can be a drop of the blood pressure, there can be breathing difficulty. These are systemic side effects, but they are extremely rare. And if at all they are happening, it can be taken care of by administering certain medicines to reduce these allergies, and the child will be definitely relieved of these symptoms also. And very rarely child can, some children are prone for this, which cannot be predicted from before. They can have seizures, convulsions, especially to DPT vaccine, and very high fever. So these are extreme situations where life-threatening convulsions can come, and these sometimes require expert care. Like in a higher center, they have to be shifted and taken care of in a pediatric ICU kind of setup. But we have to, these being very rare, we have to accept these and move forward, because the dangerous effects of low vaccine coverage is very far more dangerous and affecting the whole population. So in the US and in the advanced countries also, there are some anti-vaccine culture being developed recently in the Europe also, and mainly in America, where the number of we are seeing measles and mumps outbreaks, especially measles. Measles requires a very high level of vaccination so that the outbreaks are prevented. So in the Europe, so many reports are there in various media that a record number of cases of measles outbreak is there, with the deaths also. In Italy, in France, in USA, in particular states, we are seeing from time to time in 2018, 19, so many reports are there where the measles outbreaks are there. Like that, polio outbreaks are there in certain countries. Even if the availability is there, even if the technology is there with us, because of logistical reasons, certain countries are unable to immunize their whole population with polio. So still polio is existing in the world because of this problem. So it is very dangerous to, because of one in a lakh or one in 1 million chance of some serious side effect, not to think of not giving vaccines to entire population. That is very much more devastating, and this is a slight risk that we are taking on a personal level for the benefit of the whole community. There's no doubt in that. So the next question will be, is there any situation where the child should not be immunized? So those kind of situations is very rare and very few. One of the most common is that child is presently having fever or had fever in last 2 to 3 days. In that case, we can postpone the vaccination. Suppose child today vaccine date is there, but today he has developed a fever, yesterday he has developed a fever. So in that case, we should postpone the vaccines for 4 to 5 days till that episode of fever is resolved, and we are sure that the disease has come. Mainly viral fever or some any other fever. So that we are sure that the fever is gone, then only we give the vaccine. So it's a temporary 4 to 5 days delay in vaccine for fever of any reason. And then second is child has had bad reaction to the vaccine. That definitely is a thing to be considered. If last time the child had very life-threatening reaction, not just a local redness part I'm saying, it's a severe reaction to another vaccines, then we have to consider alternatives and be very careful when giving the next vaccine to the child. Third is reaction to allergic to eggs. The component of eggs are used in vaccine production. So if the child has a severe reaction to eggs, then also we have to see alternatives and give very carefully along with pre-medication so that child doesn't have allergic reaction that time. And then next is if the child had fits. If the child had fits during the last vaccine, then also we need to do the vaccinations in very carefully controlled situation so that we can manage any side effect if it comes. And the other ones are related to immunity. If the child is having cancer treatment, he is on high dose steroids, like that for like suppose post transplant child is on steroids for immunosuppression. In that scenario, vaccines has to be given very carefully, and there are certain rules of those vaccination also. So that has to be given after expert consultation. And next is if the child is having an immune deficiency, like suppose there is a natural immune deficiency. Some children are born with less immunity. So in that case, live vaccines is difficult to give. And again, expert advice is required in that case. Or suppose somebody has HIV or any other immunosuppressive disease, then also vaccination routine vaccination cannot be given, and expert guidance has to be taken. And anybody is on high dose steroids, suppose like as a post transplant, in that case also you have to give under means guidance, and different schedules are there for giving to those children. And then we have covered all the basic what questions I keep on listening in my practice. I have tried to cover. Then we'll cover a few slides on the myths. That will be almost the end of the discussion. Myths, like main first myth nowadays with the rise of internet, this autism thing has come into the picture. So of course we are seeing a lot of children. Definitely, in my experience, I can say the number of cases. It is not scientifically proven statistically, but I am seeing definitely more number of autism cases. Definitely, there's no doubt on that. But the study which showed that autism is caused by vaccination is a flawed study, and it has been found to be a fraudulent study actually. Fraud, not flawed only, fraud. And the person who had made that study his license also has been revoked. So if there is a general increase in incidence of any disease, we can randomly anything you tell because of that this has happened. It's very difficult to disprove also. If something is really because of any reason the incidence is increasing, because autism definitely the incidence number of cases I am seeing is more than before, like 10 years before, and now there is a definite increase. But to assign it to vaccination and then stop the vaccination is definitely not warranted, and it is proven beyond doubt that vaccines especially the measles vaccine caused the autism is what was claimed in that paper. But the studies after investigation, it was found that it is a fraud study. Those data was completely fabricated by the person. Now he has been removed from the medical. He is not allowed to practice also in the USA. And second is vaccines can cause the disease they are designed to prevent. Like in the very recently, we saw that in the second wave, when the vaccines were going on simultaneously, people are also after getting the corona vaccine, after 2 days they were testing corona positive also, and the rumors went "Ki because of vaccines I got the disease." So that is completely false. Inactivated vaccines cannot cause any disease; they are killed. So how can they cause disease? And even if it is attenuated vaccine, it can cause a very mild form of disease which is clinically not significant. So these are not true, and the fact is that these vaccines very rigorously they are made and tested also. So there's no chance of the actual organism staying inside and causing the actual disease. This is completely false. It is a coincidence, especially if you take the corona example in the second wave. The pandemic is going on, so simultaneously they are getting the actual virus from their environment and getting the disease. So definitely this is a completely wrong thing to think, and vaccine cannot cause the disease. And third is already I have touched this point. So some if somebody has missed a vaccine, they think that that cannot be given, and they'll say we'll take the next vaccine that is next in the schedule. That is not true. The benefit of the missed vaccine should not be denied to the child. Every vaccine has a long range where it can be given. Even if it is written at 1 year, it can be given for a long period of time, which the doctor will advise, and the parent should not decide on their own and decide to skip the vaccine. Then the question arises: suppose at 1 year there is one vaccine which has been missed, and again at 15 months there is another vaccine, and they come at 15 months. Then they'll ask, can we take the both together? This vaccine and that vaccine, will it cause any side effect? So there is no such vaccines which cannot be taken together. Every vaccine in each setting, usually I give 2 injections per sitting, per visit, because the less than if because there are so many vaccines in the schedule. If you start giving only one per sitting, it becomes a very long, drawn-out affair. It will never end. And uh, more than two is bit scientifically you can give. Nothing will happen if you give 3, 4 vaccines at one sitting. But child becomes under a lot of pain and all, so I restrict myself to 2 vaccines per sitting. So where the pain is little more and crying, some parents are concerned about child crying too much. I counsel them that with one vaccine also child will cry that much only. So then these 2 vaccines which are missed vaccine and the present vaccine, can they be given together? Yes, every vaccine can be given with another vaccine. There is no such vaccine which cannot be given with other vaccine. That is definitely can be done, and as soon as possible the catch up should be done on the missed vaccines also. And the healthcare provider, the doctor or whoever else is giving the vaccine will provide the necessary guidance, and parents should not be unduly worried about how to catch up on the missed vaccinations. And one more myth that I have seen is the giving vaccines will decrease the immunity of the child. It is better off to get the original disease and then develop the immunity, and not give the vaccine and provide the same benefit without the risk of the disease to child. This is a very common myth. We want our child to get the disease and be more strong. So these are totally flawed thinking. I would never wish on anybody to get polio, to get the immunity for polio, because polio is 100% crippling disease. Same with tetanus. Tetanus is 100% fatal disease, almost 95%. With expert treatment, few might survive. Rabies, 0% survival rate. If somebody gets rabies, means it is death sentence. No treatment in the world can save. So these are just for telling and avoiding the vaccination for personal beliefs, which are totally not to be encouraged. Anti-vax people, means it's very sad to hear when people talk about anti-vax situation. Of course, people will say there is the industry lobby and all those things. Definitely industry, because it's a very big industry, some lobby will be there. But maybe the pricing part, that is a different aspect altogether. But benefit of vaccines cannot be, at least in our stream, it cannot be debated actually. It is definitely beneficial beyond doubt. So there are three categories of vaccines. How I classify? All vaccines are beneficial, definitely, but one is must has to be given. That is polio, diphtheria, which the government is giving free of cost also in the national program, where the disease is very deadly. If somebody gets polio or a diphtheria or a tetanus, these are deadly diseases and high mortality and morbidity is there. So these are must, sure, definitely must be given. And secondly, should be given. Should be given. This is total my classification. It's not official. Just I'm telling for understanding. Must give and should give. What is should give? Should give. Previously, pneumococcal vaccine was in should give list. Now it has come to must give list. Government has started giving. Rota again was there in the optional. Now it has become compulsory. Like that, presently chickenpox government is not giving, hepatitis A government is not giving, and typhoid government is not giving. These three are important diseases, although the complication rate is less, but they end up like missing the exams and missing other important social functions, and there's a very slight chance, but definite chance of fatal complication also in these so-called mild diseases. So should be given category these three comes, and then third category is better to give. In that, influenza you can say better to give. Like that, some optional vaccines like meningitis vaccines there, it is very costly. Presently it's some 4-5,000 rupees. So if somebody is not able to afford, we can miss it because of high cost. Everybody cannot give a 5,000 rupees vaccine to their children. So these are the three categories I categorize for understanding. Must give, should give, better to give. These are the three for understanding. Mm, and some just some vaccines will require like 1 or 2 doses is enough for the whole life. So not all vaccines are like that, especially influenza vaccine, because the organism is changing. Then we have to give repeated dosages. And then tetanus vaccine, because of technology, the way the vaccine is produced, that immunity wanes over time. So booster doses are required. So actually, till 10 years we are giving DPT. 5 to 6 doses we are giving. After that, every 10 years, TT should be taken. Tetanus toxoid. People, what they do, after 10 years, they don't take anything, and later on, some cut is there. Randomly, after some cut, they'll randomly take on their own. So that is wrong. Tetanus toxoid should be taken every once in 10 years, every decade you can remember. Up to 10 years, pediatrician is giving. Then every decade, 20 years, 30 years of age, 40 years of age, it has to be taken. Like that, some other vaccines are there. Like adults can also take, like some pregnant ladies, if they don't recollect having chickenpox in their lifetime, in their childhood, they should take in the pre-pregnancy. Definitely, ladies should be taking the chickenpox vaccine so that they don't get the chickenpox at the pregnancy stage, which is very dangerous for the unborn child. Chickenpox can be taken. Pneumococcal vaccines can be taken. Influenza vaccine can be taken by adults, especially if there is a diabetes uncontrolled, or the organ transplant is there, like kidney or heart transplant, or immunosuppression is there. Somebody is having rheumatoid arthritis, taking a lot of medicines. So in these extreme cases, adults also should take vaccines, and they also should ask for guidance for adult vaccination. So these are the things I wanted to say today. Anybody wants to ask any question? I don't know if questions are allowed. This is the end of my presentation today. Thank you.